Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall. Our Town Hall series is presented by UP Health System Portage. I'm Steve Elmer. I'm a member of the Health Research Institute here at Michigan Tech University, and I'll be joined shortly by my colleague and co-host, Dr. Kelly Kam, who is our epidemiologist here. First, I just want to recognize our sponsors for tonight, which include, as mentioned, UP Health System Portage, the MTech Smart Zone, the Upper Peninsula Power Company, Aspirus, and the Physiological Society. We want to welcome all of our viewers tonight watching on the Zoom webinar, those of you joining us on social media, and all of the listeners out there on 97.7 The Wolf. Thanks for being here tonight. We also want to give a shout out to the students that are taking the COVID-19 class here at Michigan Tech University as well. We appreciate the support of our local sponsors as well as our campus partners, which include the Health Research Institute and the Center for Educational Outreach. The Health Research Institute organizes the COVID-19 community town halls, and their mission is to support health-focused education and training for students, research for faculty, scientists, and engineers, and also to support health-focused outreach. The goal of each town hall is to increase our collective awareness about COVID-19 and how it impacts our health, the health of our family, our friends, our neighbors, and importantly, the community at large. Tonight's topic will focus on how the COVID-19 pandemic is impacting our economy. We'll also take a few minutes to interpret the new state epidemic order by the Department of Health and Human Services here in the state of Michigan. Just recently on the Keweenaw report, there was a news release earlier today talking about unemployment rate falling in the state of Michigan, how that's comparing to the national average. So this is certainly an important topic and a timely one as well. Just a reminder, if you missed any of our previous town halls, you can view those on our website. These are recorded, they're publicly available, and they're free. Our website is mtu.edu/health-research. Once you're on the page, you can go ahead and click on Town Hall. You can pull up all of our previous recordings. Just to give you a couple of examples, we've learned about the role of public health in protecting the community. We've learned how COVID-19 impacts our physical health, our mental health, how it's impacting our students. We've had a lot of perspectives from a number of different clinicians, public health officials, and other community experts. So be sure to check out the page. Next, I want to welcome and bring in my colleague and co-host for tonight, Dr. Kelly Kam. So Kelly, good to be working with you again, and hope you're ready for another town hall.
Always. It's always interesting to learn more.
It is. So Kelly, first, can you tell us who's here with us tonight and what's coming up, a little bit of a preview?
Absolutely. So we have two speakers tonight. We have Dr. Laura Connolly, who's an assistant professor in economics in the College of Business here at Michigan Tech University, who'll be talking about the impact of COVID-19, looking at the labor market, kind of looking at it from a more national perspective. But we also know that, as we've all experienced in some way, shape, or form, that there is a local impact on the economy. And Jennifer Julian is a local business owner here in the Keweenaw area, as well as the VP of the Keweenaw Visitors Bureau and on the Houghton County City Planning Commission. That's a mouthful to say all of that. And Jen will be here to speak to us about the local impact and how this is really affecting our local economy, certainly as we've seen since everything has started back in March.
Okay. Well, thanks, Kelly, for the preview. I know I'm excited about tonight is actually our 11th town hall, if you've been counting. We've been at this every Thursday evening from 7 to 8 here, right on Zoom and social media and the radio. But before we get into our featured speakers tonight, a lot has happened since our last town hall just last week. I want to give you a few minutes here to provide a little background, a little context on this epidemic order released by the state, and just a general update, as I know even things have changed here on our campus from going to our health and safety level 3 to level 5. So Kelly, I'll turn it back over to you. Oh, and before we do that, just want to remind our audience that we have a number of important, helpful resources. So Kelly, could you just hit the high points here for any listeners out there that can't see the visual here on the screen?
Absolutely. So one of the things that's been an overriding problem within this response to the pandemic is this idea of misinformation and disinformation that's out there. So we wanted to be able to provide some resources at a variety of different levels that are there to give us good, valid information about what's going on. So we have not only our government sources, state, federal, and local government sources, as well as national, international organizations like the World Health Organization, our healthcare facilities and systems, as well as more individual groups that are working, such as the Up and Moving group that we've featured here on this webinar, Tech Tutors, which was an amazing program that students here at Tech had seen the need and gone out and actually done something about addressing that need, as well as Copper Country Strong, which is a listing of all sorts of different resources that are helpful during the pandemic.
Thanks, Kelly. We had two other resources I just want to give a quick plug. We've spilled over onto a second page here. Last week, we had Mr. David Holden from the library here on our campus talking about the 3D printing of personal protective equipment. We ran out of time, but we just wanted to mention that David is doing a fundraising activity to purchase more supplies for the 3D printing. If folks want to check that out, the website is superiorideas.org, and you can learn a little bit more about the project and how the funds would be used to, again, help address the shortage of PPE here. One other one as well, Kelly, you remember a couple of weeks ago, we had Miss Renee Hiller on talking about how we can work safely and productively from home. Given that the state epidemic order is in place, more of us are going to be working from home, obviously. And so I just encourage folks, there's some really useful resources on the mtu.edu human resources page. So that's mtu.edu/HR. You can click on the COVID resources. So I think we got all of the resources identified, Kelly, and now we'll turn it back over to you.
So as Steve mentioned, and as many of you are experiencing, we certainly have new orders for the epidemic response. This one's coming from the Michigan Department of Health and Human Services. This Pause to Save Lives. So it's a 3-week pause. And I just wanted to address not only what those orders address, but also why they're addressing them. So I think we have to back up and look at the fact that across our nation, we had over 1 million cases of COVID-19 last week alone. At the beginning of this pandemic, it took us nearly 3 months to reach 1 million cases. And last week, in a single week, we reached over 1 million cases. And the growth of this is just going to keep increasing unless we do something about it. So those 1 million people have already infected, whether they meant to or not. Nobody means to infect anybody else, but they've already infected other people. So right now, this growth is going to continue to grow. But we can do something about stopping that next generation. So 2 people down, we can stop that from spreading. And that's what these orders, as well as similar orders that are across the Midwest, are really working to do. I have children in school. I'm a university professor. Certainly this idea of going remote for high schools and colleges and universities, it's not ideal from a learning perspective or from a parent perspective, but it really is important. Although we have outbreaks across all school levels, really in the high schools and the colleges, this is where the big outbreaks are occurring. And that's really one of the reasons why those schools are closed down, whereas the younger schools are not. And again, as we'll talk about tonight, there's a balance between trying to balance and protect people's health as well as what's needed for really having a full, healthy life. And we do know that the younger students really do need to have that in-person learning when it's available. The other closures are really looking at trying to reduce the spread where we know that spread often occurs. Places that you have to take off your mask in order to be able to eat at a restaurant. That certainly severely impacts those restaurants and impacts the economy of those business owners, the people who work there. And this is, we're really looking at this as a 3-week pause. So I'm really interested to hear Jen's perspective on that, on the impact of that. So in implementing these measures, we know that these measures work. If we can implement these measures for just a few weeks, that'll help us slow the growth of this so that we can get the number of cases back down to a manageable level. Go ahead, go to the next slide. So again, looking at how many cases, over 1 million cases, or over 11 million cases, again, those went over 1 million cases last week alone. And total deaths continuing to rise. And as those numbers of cases rise, we do expect that those deaths will rise. And in a couple slides, I'm going to show you why we look at that lag between the number of cases and the number of deaths. I also wanted to show just that heat map of where these cases are occurring. So early on in the pandemic, the cases really were along the coastlines, along our West Coast and our East Coast, and really focused among the cities. And we're really seeing a spread now where this is coming and hitting the rural areas and our local areas, as well as our areas across the Midwest. So the darker colors there are the larger numbers of cases per population. So this is balanced out for the number of cases per population. And we really can see that this growth is really hitting us hard in the rural areas and across the Midwest. The next slide, please. So as we talk about Thanksgiving coming up and why it's so important to follow these recommendations from our local and state health departments, as well as the CDC, that really sticking with having your Thanksgiving just within your own household. So I just wanted to show why we're looking at that. So that yellow line at day 5 there is that dinner on Thursday. And particularly for our students who may be traveling, or many other people who may look to try and travel on Saturday. If you travel on Saturday and you become infected on Saturday, that purple peak there is when people become when they show symptoms. So this is the incubation period. So if they're traveling on Saturday and get infected on Saturday, then that peak is going to happen about 4 to 5 days. So that's that peak of when many people, when the median time when people would start to develop symptoms or test positive. And unfortunately with this, many times it's just really mild symptoms. So it may just be a cough. They might have a little bit of a runny nose and not think anything of it and sit down to dinner. In addition to being worried about those people sitting down to dinner that are already infectious and have symptoms, we also have to think about that group of people that are going to become symptomatic within 2 days after Thanksgiving dinner. So that line all the way up to day 7, those are all the people that have the potential to infect the person that you're sitting next to at Thanksgiving dinner. And this is why it's really, really critical that especially during this time, we take precautions to make sure that we're not infected when we sit down to Thanksgiving dinner, and we keep our celebrations small and virtual if at all possible. Next slide, please. So again, also looking at what that means if somebody does get infected on Thanksgiving, and what that particularly may mean for our older populations and those grandparents and parents that you want to celebrate the holidays with. I miss having my children and seeing their grandparents. I miss seeing my parents and my in-laws, but this year it's just going to have to be a little bit different. So, and the reason why is if we look at that, if there was an infection that happened when sitting down to Thanksgiving dinner, again, that incubation period can be up to 14 days, but the median incubation time is between 4 and 6 days. So that means by the end of November, you're going to have about half the people that got infected at Thanksgiving are going to start to show symptoms. Now, for our student population, we've really seen that those cases tend to be very mild cases. And so they're feeling pretty crappy for 3 or 4 days, maybe a little bit longer, but by 10 days, they're feeling better and they're out of their isolation period. But unfortunately, if you're sitting down to dinner next to someone who's higher risk, that may mean that they end up in the hospital. And what we do see is that about 7 days after 7 to 10 days or 7 to 10 days after becoming symptomatic, the people that are going to be hospitalized, that's when they go into the hospital. And those people that are hospitalized, some of them were going to end up in the ICU. And we do see that those severe cases, about 10 days after they get symptomatic, that's when they're showing up in the ICU. And many of those patients in the ICU won't survive. Now, we are getting better at keeping people alive. We're learning a lot more, and our healthcare systems are doing an excellent job, but there are going to be people who die. And those ICU patients that die are usually going to happen about a week after they've been in the ICU. So right before Christmas is when those deaths are going to start to occur. And we're going to have continual, not only everyone that's not everyone in the ICU, but there are going to also be some people who are hospitalized that never are in the ICU but still die. There's much fewer people who with moderate illness are dying. It's really the severe cases that are dying. But we can protect those people. And again, it goes back to that infection that happens at Thanksgiving. So really doing what we can to protect those people who are at that high risk of hospitalization and ICU so that we don't have to deal with those deaths right before Christmas. So again, when we look at all these numbers, many times people have said, well, the deaths are, we have 1 million cases, but we haven't seen that high level of deaths. Well, that's because from what I just explained, that these deaths actually are a little bit of a lag behind when the cases occur. So lining up here, these are cases in Michigan at the top and deaths in Michigan to the bottom. So the scales on the y-axis are different. That's why the peak on the bottom looks so much bigger than the peak on the top. But that's not the case. It's just the scale of that graph. But when you look at the orange lines lining them up, that we see the peaks of the infections happening about 2 to 3 weeks before we see those peaks in the deaths. And so that's what we're looking at. And that's what we're really worried about, is that we know these cases are rising as it is now. And we're worried about those deaths that are already going to be happening because that biologic decision, in a sense, has already been made. Next slide, please. So I don't want to leave on a depressing note here. So there are things that we can do. As I said, there are people who already are infected, and there's not much we can do in terms of stopping their infection. They are already infected. Our healthcare systems and our healthcare practitioners are working hard to make sure that they are being treated and we don't have the deaths that occur. But some of this is inevitable, but a lot of it is not. And if you look at this graph, that sort of the dotted lines are where we're starting to have projections here. And that middle line is the projection as if we keep going the way we are. We have the mask mandate and the mask recommendations and the mask use that we have currently. We're kind of on the same system of what we're doing now, of that when things get really bad, there's mandates that are put in place, but they're eased when things get better. That bottom line is if we keep our mask use in place as it is now, but we just keep taking away any other restrictions and just keep removing them and never put them back in place, no matter if things get worse or not. But that top line, that dotted red line at the top, that's if we continue what we're doing with these kind of rolling mandates as we need to put them in place and take them away. But if we can get up to 95% mask use, so almost universal coverage of masks, that's how much we can change things. Oops, no, sorry, the other way. Flip it over, the red line, or the green line, I'm sorry. The red line's if we take away things and keep going with taking away things. The green line on the bottom there, excuse me for that, that's if we get our mask use in place and how many lives we can potentially save just by getting everybody into their mask use. Next slide, please. So again, this is just looking a little bit at what we can do and what does it really mean to have this universal mask use. So that top line there is looking at the daily deaths. So really seeing that when we put mask use in place, we really can have a pretty significant impact on reducing the deaths. And really this idea of these rolling changes, as hard as they may be, and again, that we cannot underscore the economic impact of this, but in terms of the health impact, these rolling kind of mandates of adjusting when we get really high rates of cases can have a pretty significant effect. So we don't follow that red line, we're following the that kind of brown line and the green line down below. And again, that universal masking is not 100% because we know there's some people who can't tolerate masks. Young children don't do very well with masks on. But if we can get people up to 95% wearing masks in public places, we really can have an impact. And just a little bit of a reminder of what we mean with these masks. This is from CDC. So choosing masks that we have a little bit of evidence or more evidence on what works, but also making sure that it's a mask that's tolerated. So making a mask that you can breathe through, that's a breathable fabric, that's washable, that completely covers your nose and mouth and fits snugly against sides of your face and doesn't have gaps, especially if you're fitting masks for children. Have a mask that's fit for children, or at least adjust it so that it's also fitting for them. There's been certainly lots of different masks out there, but we don't, if you don't need to have one that's vinyl so that it's difficult to breathe through, that's not a recommended one. Although certainly if there's needs for accommodation so that people can be able to read your lips, then some of those plastic masks have been really, really useful for those populations. And remember that an N95 mask is intended for healthcare workers. It does require a specialized fit. It's not just an off-the-shelf kind of mask, and so those we really do want to keep those for the healthcare workers. Next slide. And this is just a reminder of how not to wear your mask. So it does need to cover both your mouth and nose, not either one or the other. And certainly I've done this where it's dangling off my ear while I'm driving in my car alone, and then I forget to put it back on as I get out of the car. But it really doesn't help if it's just hanging off your ear or you're carrying it in your hand and forget to bring it onto your face. So just a little bit of a reminder on that.
Okay. Well, thank you, Dr. Kelly Cam, for the update. We really appreciate it. There were a couple of questions that have started to come in. I just want to remind folks there are two different ways to send us questions. You can, if you're on the Zoom webinar, you can use the Q&A button at the bottom. If you're out there on social media or listening on the radio, you can send it via email to townhall2020@mtu.edu. A quick question here, grappling with the, maybe the bad news with some potential promising news about vaccines. We've heard about two in the news, the Pfizer and Moderna. Can you shed some light on what's the latest with vaccines and how that, if that's on the horizon, what does that mean for the epidemic order, the mask wearing, et cetera? Kind of when do we let our guard down or keep it up, so to speak?
Absolutely. So yes, the news about the vaccines is absolutely wonderful and to be commended for all of those workers who have been putting in amazing work to get the science behind that as a global collaborative to really work on the vaccines. It does mean it's going to be quite some time before we're able for the general population to be able to have that vaccine. So we cannot let our guard up. every day that we're not wearing our masks is a chance that somebody's getting infected now. And that person, if we can prevent them from being infected now so that they are still healthy and able to get the vaccine when it becomes available. Estimates really are that for the general population, that the vaccine would be more widely available next summer. But hopefully our healthcare workers, if everything continues to go well, our healthcare workers and frontline responders will be able to be protected as our most critical group to vaccinate first. It is quite a logistic challenge to be able to figure out how to get all that vaccines distributed around the country. And that'll take some time.
One follow-up question, Kelly, this came in from the chat here, or excuse me, email. This person is trying to decide if they should travel or not over Thanksgiving. We've gotten this from both students and community members. Can you just provide some context? If somebody does travel home, do they have to quarantine once they get home? And then how long before they can make the trip back to the Upper Peninsula?
So anytime you travel, you should either be quarantining before you leave or quarantining after you get there. So in order to really make sure that you're not bringing the virus with you, then you need to make sure that you're not infected, and you can do that by really limiting any exposures that you may potentially have for 14 days, either before you leave or when you arrive. One of the other things you can do is absolutely get tested, although a test is not a substitute for safe behaviors. And just because you test negative, if you've had a recent exposure, it does not mean that you're not infected. And so you really have to be careful of making sure that you're really wearing your mask, washing your hands, watching your distance, keeping yourself healthy, keeping yourself within your own little kind of pod, as Dr. Helt talked about several webinars back on that. But absolutely being safe on your travels as well, so that you don't become infected during your travel, if you've taken the time to do the quarantining before you left.
Okay. Just want to welcome in any new viewers or listeners that are just tuning in. If you'd like to see some of the visual content on the Zoom webinar here or Facebook Live, if you're out there on the radio, you can go to thewolf.com and click on one of two links to join us and see some of the visual content. We're going to move on and bring in our next featured speaker. Tonight, I have the pleasure to introduce and welcome Dr. Laura Conley, who is an assistant professor of economics here in the College of Business at Michigan Tech University. So, Dr. Conley, welcome to the town hall, and we're looking forward to your brief presentation for the community. So take it away.
Thank you. So I am going to focus a little more on kind of a national perspective, looking at how the COVID-19 pandemic has impacted the US economy. So the first kind of figure I've included is looking at GDP, so gross domestic product, which is probably the kind of number one economic indicator that most would look to kind of see economic activity and really economic productivity within a country. So if we look at the US, what you can tell, particularly from this figure, what I'm hoping at least stands out, is you'll see there's, kind of pretty consistent growth from 2016 through 2019, small, but they're all positive. And then when we get to Q2 or even Q1 for 2020, we see a slight decline in quarter one. So that's January through March. And then for quarter two, we see a huge decrease. And so quarter two would be the start of April, which is probably about 10 days in to when most of the lockdown orders first went out. And so to put a number to that, the real GDP decreased on an annualized basis, which is how it's normally presented, about 33% just in the second quarter of 2020. So that's huge. That's the largest economic shock that most of us have seen in our life, and really the largest economic shock probably since the Great Depression. And even in comparison to that the Great Depression, it's the speed at which we saw it happen that was so unique with this pandemic. So while that's obviously discouraging, that's a huge economic contraction. You can also see in quarter three, we have made back a lot of that loss already. So you kind of have to keep in mind, though, this is on a national level. And we know that there can be differential impacts across industries. Certain industries have been impacted more than others. And it's also important to note that for that decline we saw in the second quarter, while that's a huge decline, we also have to think how much larger would it have been without some of the federal government interventions, like the stimulus package to get a little bit of money to workers. They have paused student loan interest and payments. They had some loan programs for small businesses, that all of that kind of helped kind of mask some of the larger negative effects we actually would have seen without some of that to kind of cushion the blow of the lockdown orders that we were all under. So I don't have a picture for it, so we'll stay on this one for just a minute now. But kind of tied to this GDP is also some of the stock market activity. So kind of more from a financial market perspective. So looking at that same time frame, so kind of mid to late February through early April, kind of the beginning and real peak of that pandemic when it first started, the stock market lost about a third of its value over about a 6-week period. So again, that's the largest contraction we've seen since the Great Depression. So these are, really unprecedented drops in economic activity and financial markets that we're observing. Another positive, the stock market has recovered most of its value since then, but it's important to note that the recovery has been driven by really large gains in particular sectors. So for example, software and technology sectors have really soared in light of the pandemic because we're all sitting on Zoom for this rather than, in a big auditorium lecture hall kind of thing. Healthcare, a couple other industries like that have really seen large gains, but they're not necessarily reflected across all industries. So those stock market gains are being driven by big performances by large companies in specific sectors. But it's important to also think kind of what's been happening to small businesses during this time. So let's take a look at the next slide. So what I have here is it's looking at small business revenue, and this is in comparison kind of showing the full year for 2020. So the data stops in August, so it's a couple months old now. But it's important to think of small businesses because from a nationwide perspective, small businesses actually account for about 50% of private sector employment. So a ton of workers are employed by these small businesses. So they can really be the backbone of job creation in particular, and obviously as individual workers, having more employment opportunities and more stable employment opportunities can be a big positive on that individual level. So kind of even as we see, there was a big drop in April and May in revenue, and it has started to trend upwards, which is a positive. We still see, they have yet to reach revenue for small businesses overall has yet to reach those pre-pandemic levels again. And you can see there's been some differential effects across industries. So leisure and hospitality has been one of the hardest hit, particularly if you think of, people aren't traveling or people aren't going out of their home as much, that, a lot of the kind of differentials by industry, they make sense in terms of what the lockdown kind of ordered and maybe what people are comfortable or not comfortable doing in light of the pandemic. So now I'm going to focus a little more on the labor market. So we can take a look at the next slide here. So most of my research actually focuses on the labor market. So I'll have a little bit more here, but I didn't want to gloss over kind of a little more big picture on the economy as a whole. So I have a couple of figures here, but to kind of put this into perspective, in kind of the height of the pandemic in April of 2020, the US economy as a whole, we lost 20 million jobs, which was the highest on record for any month since they've started keeping those employment records. And at that same point, unemployment peaked at about 15%. This was in April. So if we take a look at the figure on the right, what we see is it compares the unemployment rate in February 2020 for men and women, and then again in May 2020. So obviously, the pattern has continued since May. But what we see is that unemployment rate isn't necessarily equal across different groups of workers. So for example, women have been hit harder than men have in terms of unemployment. And then if we were to break this down by minorities versus white or Asian, for example, we would see a similar pattern. So both Black workers and Hispanic workers have also experienced kind of higher unemployment rates than white or Asian workers have. And it tends to be even within those different racial or ethnic groups that unemployment for women is a little bit higher than the male counterpart there. So kind of the good news is unemployment has continued to decline since May 2020. So I know in one of the prior slides, it was mentioned that unemployment in Michigan in particular had decreased a little bit, and it was actually lower than the national average. So the latest estimate for national unemployment for all workers is about 6.9%. So we have seen a significant number of jobs have been recovered and unemployment has declined, which is a great trend, and we want to see that continue. But kind of the bad news is we're still at about 50% or the unemployment rate is still about double what it was at pre-pandemic levels. So from an employment perspective, we're making some of those gains, but we're not quite back to where we started yet, like we've seen with GDP or even the stock market. So unemployment is taking a little bit longer to catch up there. And then if we look at the figure on the left, what's kind of really become obvious since about August or September, since school would have started back up, is that we're seeing this new trend that not only is unemployment higher for women, but we're also seeing a higher number of women drop out of the labor force altogether. So unemployment meaning they don't have a job, but are actively searching and want to be employed. Leaving the labor force means they're stepping away from the labor force. They're not actively looking for a job. So they're, taking themselves out of that population of workers. So just for September alone, we saw about 865,000 women dropped out of the labor force, which is a pretty significant number. And that's the highest single month we've seen since the pandemic started. And again, that's most likely attributed to school starting back up and then this kind of shift to remote learning and working from home. There are a lot more household duties that have to be taken care of, and that tends to fall disproportionately on women. And then if we look at it kind of from the start of the pandemic in March through September, what we see is about 2.1 million women have dropped out of the labor force since the start of the pandemic. And that's in comparison to about 1.5 million men. So, men are being impacted as well, but we're seeing a much higher impact on women and particularly women of color in light of kind of these disruptions that COVID-19 is causing to their ability to, do their job as well as, take care of their family and keep their household in order. So one statistic I thought was pretty jarring, honestly, was it's the labor force participation for women in October 2020 is now at the same level that it was in 1988. And so this kind of large exodus of women from the labor force has really wiped out a lot of gains that women have made over the past 30 years or so. And what'll be interesting is we're still seeing some women come back to the labor force. So what we don't know is this temporary? And, we're going to see this trend reverse itself in the near future as we get more promising news on the vaccine and if schools are able to return to in-person learning, or if this is going to be, a more permanent long-term trend that will take much longer to recover from.
Great. Thank you, Dr. Conley, for the presentation here. A couple of questions that have been coming in. I want to start with this one. Talking about the impact on the small businesses during the pandemic, and are we seeing big businesses kind of fill that void or actually benefit, so to speak, during the pandemic? Can you provide any perspective on that?
Sure. Yeah, that's a great question. So kind of from what I've read, not necessarily hard data numbers here to back it up, but it does seem that particular big businesses, so ones that have been considered essential with selling groceries or have a large virtual presence as people are, not wanting to go out and shop as much, and they're able to, fulfill those online orders. It's like we've seen companies like Amazon grow a ton during the pandemic. And I think Walmart had their highest they had kind of their highest profit or highest numbers reported since the pandemic started. So we have seen some of these large businesses have, really performed well during all of this, but what is unknown at this point is I don't know how much that's trickling down to workers, in the sense that some stores will have had to hire more workers. So in that sense, that could be where some of these new jobs are coming from. We're seeing new jobs being created despite some of the contraction. So I do think a lot of that has been due to big business activity, but I also think as small businesses, if they've been able to kind of survive the pandemic thus far, is they've been able to reopen their doors and kind of re-engage in more normal business practices, I think they are still able to contribute as well.
Okay. Next question here is from a retired history teacher in the community. He's asking, are there any lessons learned from the Great Depression or the previous pandemic 100 years ago on how the economy might rebound once we turn the corner on everything down the road?
Sure. That's a good question. So I think, in terms of the level of the shock, the economic shock itself, it definitely draws some parallels to the Great Depression in terms of the magnitude of the economic decline that we've observed. But what I think is very unique about this pandemic relative to the Great Depression is the Great Depression was a much longer event in terms of it took a lot longer to see that drastic economic decline. Whereas for the COVID-19 pandemic, we really saw the drop occur in about 6 weeks, which, I mean, there's nothing that we in history that, we would have any numbers on at least that could mirror that. So there are definitely some parallels to be drawn, but I think the difference in terms of the speed, both in terms of the decline and the recovery, because the recovery has been much quicker than it was for the Great Depression as well, makes it a little bit difficult to draw some direct comparisons. And there it was, kind of a financial crisis that kicked off everything with the Great Depression. Whereas here, it's a totally different ballgame it was more of a public health crisis. The economy was actually doing very well leading up to that. So I do think it's a little bit difficult to draw some direct comparisons between those. And I've seen some work that's comparing it to, I believe it was the Spanish flu that was in the late 1910s. But I'm honestly not, I'm not too up to date on my economic history. So I don't want to give any false information there. So it's a good question and it's definitely worth looking into. But I'm not quite sure there.
Great, thank you, Dr. Connolly. We do have a couple more questions. I'm going to save those for a little bit later. We'll come back to you. Just reminding folks, we're here for the COVID-19 Community Town Hall. We're learning more about how the pandemic is impacting the economy. We've also had a public health update from Dr. Kelly Cam. If you do have questions, you can send those in using the Q&A button on the Zoom webinar, or you can email those to us for any listeners out there on the radio to townhall2020@mtu.edu. I also want to take a minute and just recognize our sponsors for the Town Hall series, which include UP Health System Portage, the Upper Peninsula Power Company, the MTech Smart Zone, the Physiological Society, and Aspirus. So thank you to our sponsors. We're going to welcome in our next featured speaker tonight. Next, we bring in Jennifer Julian, who's a local business owner. She's also on the Houghton County City Planning Commission and also a VP in the Keweenaw Visitors Bureau. So Jennifer, thanks for being here at the Town Hall. And I know you're going to provide a little bit more of a local perspective on how the pandemic is impacting some of the businesses here in the area. So.
Great, thank you, Steve. And thanks for having me. I am a local business owner. I employ with my husband about 150 people in this community. We have 6 different businesses and we're very connected with the other business owners, both downtown and regionally. So I hope I can share some valuable information here. I actually asked Steve to not make me pinpoint anything directly that I would be speaking of based on the news Sunday night. As Laura spoke a lot about recovery for small business owners, especially locally, we were in a recovery phase. And I feel like, with the announcement of the new regulations on small businesses and what can be open and in what capacity right now, that recovery mode is no longer active. And there's quite a few businesses that are going to really immensely suffer from even a 3-week pause at this point. Couple things that I will touch on in that are, I guess I'll kind of discuss a little timeline of events here. So as a small business owner in March, with the original announcements, they were similar to what we're going through now again, where restaurants were the first to close in-house dining. And our restaurant owners, especially our local restaurant owners, have taken a very large hit during that. If you could advance the slide for me, Steve. Slide, sorry. There you go. So this photo was actually taken in March. We went around and grabbed some photography. You can go back one, sorry. Grab some photography of what was going on with the local businesses. And originally the restaurants were told to close their dining rooms and to offer takeout services only. And so what this did was, first of all, it eliminated a lot of jobs. So when restaurants only need to do takeout, many restaurants, especially at the scale that are in our local communities, would do that with just the owners of the restaurants or maybe one other staff member. So it just doesn't require a full staff anymore. there's a lot more cost associated with doing that. You have takeout containers, all of a sudden you're putting a $3 pastry item in a 50-cent takeout container, and you're losing pretty much any margin that would have been on that item. And I'm not a restaurant owner, but so I don't want to speak completely for them, but I do have quite a few friends in the restaurant industry locally that are going through these transitions. So once the restaurants were closed, and then came the news very quickly, and really for a small business owner, it came out of nowhere, was salons, spas, theaters, basically everything else everything else needed to be closed down, and everybody needed to stay home. And for a small business owner, the option of staying from home and working from home is really non-existent in many cases. Hotels were hit very hard, as Laura showed, the hospitality industry, the leisure industry, anything that had to do with weddings. None of that can actually be done virtually. So you're thinking of all the employees there that are really, especially through the summer, or through coming up into the summer months, we're really questioning, whether or not those businesses would reopen, and if they would have jobs when they do. There was a lot of pivoting. You saw a lot of businesses, as they are doing now, announcing that they're going to take out only, or that they're, all of a sudden they're able to sell their retail online, and they're going to try out shipping. And for small business owners, those are a lot of additional expenses. They don't get shipping rates the same way Amazon does, and they can't buy boxes at the rates that Amazon does. They also maybe never have shipped before, so all of a sudden they're trying to ship things, and they don't have the right packing material, and things are breaking, or there's a lot of loss of revenue just from having to try that out. A lot of restaurants that have never done takeout before are having to install takeout windows, things like that. So this is all going on like the March to May time period. Everybody's pivoting, everybody's waiting. They're up all night reading emails from the Small Business Development Corporation, and from the health departments, and from the governor, and all of a sudden all this information is flying at you, and you really are reinventing your business at that point. In the meantime, your bills haven't changed. So especially if you're a brick and mortar business, you have mortgages, you have utilities, you have all of these bills that still have to be met. And I'll go into in a minute. I know Steve asked me to talk a little bit on guidance and assistance from the government, and I'll go into that in just a moment. So here you are in the March to May timeframe. A lot of uncertainties, a lot of financial strain for these people. Not only do they have their business expenses, but they have their own personal expenses. So on top of having a mortgage or rent for their business, they have a mortgage or rent for their own home. I watched restaurant owners clean out their freezers and their refrigerators at their restaurants and hand it to their employees, because they didn't know at the time. This was prior to the unemployment additional $600 a week coming in for that. So restaurant owners are sending home food with their employees because they don't know how their employees are going to eat their next meals. Things like that were all happening locally on a local level. We were sending people home with whatever you had. And so you really started to drain your business of anything you had in it, not knowing when it would be open again. June opened our businesses, and we were open for tourism, and actually the local economy had a really wonderful tourism year. We were told back in March to remain optimistic about tourism, because we had a very similar event happen with 9/11 in the UP. Post 9/11, a lot of people limited air travel and did driving destinations. And the UP is a really great driving destination for many people from Chicago and Detroit and Minneapolis. And we have quite a few major cities where we're a great destination for them, and we're naturally socially distanced, I guess, from what we've been told. So we did have a really good tourism year. There were a lot of challenges with that. At that point, for a small business to reopen at a max capacity of what we experienced with tourism, we had a lot of supply chain issues. Imagine getting toilet paper for your home, try to get toilet paper for a hotel at that point. There were supply chain issues, really wild things, like we couldn't reorder linens because the hotel suppliers had lost their ability to purchase from the manufacturers because they couldn't pay the bills. And so all of a sudden, we had to go directly to manufacturers to get bed sheets because the hotel suppliers are in such a hard financial position that they're losing all of their ability to do those things. You were seeing a lot of staffing issues. What happened with unemployment was very unique. It did help a lot of people. It was totally necessary. And there's a lot of people who made a lot more money on unemployment than they had made in their jobs before. And so we ran into situations where, maybe we had a high schooler that had worked for us pre-pandemic that had made about $80 a week. All of a sudden they were eligible for $792 or whatever the math works out to there a week. And so over the course of the summer, they saved enough money where they didn't have to work again once it reopened. So we lost a lot of our workforce, especially from the customer service level, to people that didn't necessarily feel like they needed to go back to work. And so you saw not hiring signs everywhere. You saw it on Culver's, you saw it on Subway, you saw it on all especially the minimum wage paying jobs. And people had a really hard time with that demand. How am I doing on time, Steve?
We're great. Go ahead, Jen.
Okay.
Go ahead. All
right. And anyway, so you ran into a lot of those situations. I personally was a housekeeper every single weekend this summer. And the employees coming back, it's a lot of strain on the employer, but it's also a lot of strain on the employees because all of a sudden the business that they worked at before has completely changed, and the things that they need to learn and the things that they need to know how to help operate that business have changed. It's a lot of cheerleading. A lot of the business owners go to bed at night, not knowing what tomorrow's going to bring, and then they have to wake up and show up and be a cheerleader as well for their whole team and just be very optimistic. So with this second announcement that just happened on Sunday, closing a lot of these businesses again or limiting them, I think it'll be really interesting to see what happens, and not interesting, but actually really sad. So there's already been a couple of announcements coming out of the Marquette area of businesses that are closing their doors for good. It is really, really hard on these businesses. 3 weeks is a really long time. That's almost an entire month of another set of mortgage and bills and things that they need to pay. And this time there's not the promises of unemployment for their staff like there was before. And there's no stimulus package, and there's a lot of things that these owners are grappling with as far as what they can do to continue on. I'll go over really briefly just some of the assistance and guidance that was provided to businesses. There's not a one-size-fits-all package in those. I'm sure based on expenses to income, or expenses to revenue ratio, that some people actually made up quite okay, and maybe they didn't get pushed too far behind in their expectations of what their business would do for them that year. But many people, especially with brick and mortar, and with previous loans and expenses, depending on how long their business has been open, especially businesses that are, within the first 5 years of their growth cycles, were hit really, really hard. And there's not a single package that could help replace or, continue on with some of the things that happen. I briefly touched on what happened with unemployment, but because the federal government gave out things like a stimulus package and unemployment, and they gave a lot of things to workers, they gave out lesser to people like landlords, for instance, got absolutely not a single package that would have applied to them, especially if the landlords have no employees. They weren't eligible for PPP. They weren't eligible for anything like that. And I think the government's idea behind that was, well, we gave the renters, a stimulus, and we gave the renters unemployment assistance. And so we stimulated the economy, so people should be able to pay their bills, and we shouldn't have to bail out people like the landlords. And I don't want to get too political here, but that's kind of the realm of what happened in that instance. There was a PPP program called the Paycheck Protection Program, and that was meant to cover payroll costs for up to 8 weeks for a lot of businesses. That was based on how many employees you have. There was the EIDL, which is a low interest loan. So they gave small businesses low interest loans with 30-year terms on them. Again, it just depends on the business as to whether or not that was able to help. And then there were quite a few grants floating around. I like to call these grants, I like to say that they're similar to student scholarships. They're competitive, and there's not a lot to go around. So it felt like when I was in college and I got a $500 scholarship on a $16,000 semester bill. And obviously anything helps, but there was nothing that, could have actually covered what happened. So although the grants were helpful, most of them were capped at, about $5,000, which to some businesses won't even cover a month's rent. Additionally, I guess on that, when you look at what's about to happen next and what's about to happen, especially locally, in the state of Michigan alone, over 2,000 restaurants have permanently closed their doors from the pandemic. That's reported by the Michigan Restaurant Association. And so if you equate that, let's say just on average, those restaurants have 5 employees, that's about 10,000 jobs gone permanently in our small business. And as Laura stated, also nationally, but more so in the state of Michigan, and even more so regionally, over 50% of the jobs are created by small businesses. And you can just think of the spiral effect that goes on from that. So what that means for us locally, it means that the small businesses especially need the support of the community. The small businesses account for over 50% of the taxes that are paid in our community that go directly back to our community, that fund our police officers, that fund our fire departments, that fund our schools. The largest taxpayers in the community are the private hospital and then the landlords. And then after them, it should be the hotels and then additionally the business owners with real estate, brick and mortar. So I think I'm getting wrapped up here, but when you think about it from a tax basis, this is a yin and yang relationship with our university. Michigan Tech is tax exempt. Michigan Tech does not pay property taxes, even though they have a large section of property in the city of Houghton. So that is really supported by the rest of the community. It's really supported by the small businesses. And so we both need each other here. And for us to be able to recruit really great professors, to recruit really great students, to have families that want to come here, we really need to continue to be able to support the quality of life that our small businesses provide in the area. So I guess on that note, I'll end it with this week really changed what my talk was going to be about. And I think if you are considering, your holiday shopping, to consider shopping local, to consider getting takeout from your restaurants. You'll notice a lot of them. Thank you, Steve. These are the people of your small businesses. There were a lot of pictures that I could have provided here of all of the people, and I couldn't get them all on one slide. But these are just a few of your small business owners and the things that are happening and the people that they employ. Try to get takeout if you can. A lot of the restaurants this time have some lessons learned, and you'll notice they're only open a couple days a week for takeout. They can't support paying people all week long without knowing that there'll be a demand to support those paychecks. So some of them are only been open Saturday and Sunday this time during this pause. Shop local if you can. Like I said, I personally, with my husband, have 2 apartment buildings that pay more property taxes than Walmart does. And Walmart will always have attorneys to fight that they will not pay more additional property taxes. So all that's happening by shopping, at these other companies are that we're pushing the commerce that way and away from our own community, away from our community's tax base and away from our community's jobs. So again, I thank you guys for having me here. I didn't want to get too into shop local and get takeout, but shop local and get takeout.
Thank you, Jen. A couple of questions that have come in. I think you addressed the tourism from a summer perspective. This question here is kind of a thinking ahead to the winter tourism. Can you comment on that at all? On how businesses are trying to plan and prepare for the winter?
Yeah, so that again changed. I woke up Monday morning to a very large number of cancellations, and especially with December commencement being canceled. That'll be a large hit to our area, especially if parents aren't, coming up to celebrate that with their children. I think we'll really have to see what happens in our season of snow tourism, as far as, hopefully people will continue to want to get outside like they did this summer, and maybe we'll see some skiers coming to the area and snowmobilers and such like that. But as far as events in that, within the near future, everything has been canceled. And so I would say, our hotels are going to be pretty empty for a while here. So.
Another question that came in, this looks like it's from a high school student. Are any businesses out there, you mentioned some of them before, that are hiring right now for temporary help for the holidays?
Yeah, I think there's a lot of uncertainty. I think last week the answer was yes, and this week I think that those people are probably a lot more cautious to hire at this point, especially with the restaurants going to a takeout situation and not needing as many staff. I would definitely look to apply to some retail jobs, as they may be a little more hopeful than others at this point. But yeah, the hospitality industry and the food industry are probably on a pause.
Okay. One last question for you, Jen. You talked about, creative ways for businesses to make it through this. Any one specific example or anything that you can highlight of a business or businesses out there that were really showing the resiliency, the creativity to do whatever they needed to, make it through this?
Yeah, there's quite a few things that come to mind. The greatest thing that I think that has happened for our area in the last couple of weeks, and hopefully will continue to be through this 3-week pause, is that we have DoorDash now. We're like a major city, guys. So DoorDash is a third-party app that will deliver to whatever restaurants are subscribed to that service. And so that's huge, because there was a time this summer, and bless their soul, there's a Pizza Works downtown. They're like the sweetest people. I would go there once a week. I don't even like pizza. You can ask any of my friends. I hate pizza. But I would get pizza once a week, and the owner would always say, thank you for supporting our small business. And she's the sweetest thing. But we would talk about problems about employment, and the hardest thing was that they could not get enough people to deliver pizza. So they were limiting themselves in how much they could sell, because if they couldn't do delivery, a lot of people, would go somewhere that would deliver, which would be Domino's or somewhere else. So DoorDash is huge for our area, to be able to have somebody delivering for these restaurants that couldn't deliver. Another thing that happened recently is that these restaurants and a lot of these businesses are just like kind of throwing their arms up and saying, you know what, I'm just going to use whatever marketing I have to use to make people laugh at this point. And there is a coffee shop up in Calumet that came out with a coffee label on the front of their bag that they're selling that says kind of a profane word, but it's not actually, because they use their logo instead of the vowel. And then it says that, this coffee was made with the blood, sweat, and tears of our derailed dreams. And they've sold a lot of those coffees in the last 3 days. The timing was really wonderful. So lots of things like that coming out. A lot of these people are pushing stuff out to social media. It's the only way to get the word out right now. So I think if you continue to look there, you'll see a lot of unique situations happening.
Okay. Well, I just want to thank all of our speakers tonight, Dr. Kelly Cam, Dr. Laura Conley, and Jennifer Julian, for their insight and their perspective. We really appreciate it. Lots of good information. Just a couple of closing announcements here as we wrap up with our town hall. Again, I need to thank our sponsors, which include UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, and the Physiological Society. Just want to remind folks as well, if you missed any part of the town hall tonight, it will be posted on our website in the next couple of days. That website is mtu.edu/health-research. Just remember when you're on the page to click on Town Hall. Our final town hall will be 2 weeks for tonight. We'll be off next week, of course, with Thanksgiving. Our topic in 2 weeks will be talking about the pandemic and health disparities. So building upon some of the information that we learned tonight. I want to thank everyone for watching tonight. I want to thank the students also, a number of folks behind the scenes that helped make this possible. We will see you in a couple of weeks. So have a safe Thanksgiving. Be healthy, follow the CDC and the recommendations from Dr. Cam and others, and we'll see you in a couple of weeks. Thank you.